Welcome to Adapting Place. Weight-based dosage calculation is always very confusing. Sometimes they give you information that you don't need to use it. You are in the right channel. Stick around. I'm going to show you how to match them, answer those questions related to that. We have 4 questions. They get harder and harder and harder. They build up in terms of difficulty. So you want to stick around and watch, especially the last question, because that's the key aspect that most of the time they may ask you. Let's get to it. This is the first one. I'm going to show you the key things you need to know. There may be few questions, there may be long one, but your job is to figure out what is the question asking and what parameters or values you need to use. How many milligram per dose? This is what you need to focus on. I'll write it here. Milligram per dose should the nurse administer. That means that's my answer choice. A provider orders what? Cefazolin. This is the prescription. This is the prescribed dose of what? 50 milligram every kilo per day. So every day, patient is going to get 50 milligram based on their weight, right? So per kilo, if you weigh 1 kilo, you're going to get 50. If you weigh 2 kilos, you're going to get 100 milligram per day. But this dose is going to be divided into 2 doses per day. People always get confused. He said divided into 2 doses. That means whatever dose you're going to get, if it's 200, I'm going to give you half in the morning and half in the evening. So this is divided into 2 doses. It doesn't mean that the answer choice is 2 doses, right? It means the total amount, the 50 milligram per kilo will be divided throughout the day. One half of it will go 12 hours, the other is 12 hours. What is the available? The available, that is available, right? It's not given. They do not tell you because that's not, you don't need that information. So don't worry. Oh, what is the available dose? You don't need it. So this is 0. But they told you the child weigh what? 20 kilos. That's all. And you know that every 50 kilos, 50 milligram per kilo is per day. That's what the patient is going to get. Based on that, you want this answer choice to look like that. I want milligram to be on top, right? Therefore, 50 milligram per kilo, right, per day. So throughout the day, that's what the patient is going to get. But the patient weigh what? 20 kilos. Therefore, in order to get rid of the kilos, you put 20 here. 20 kilos right here. What is the key? These cancel this, and you have what? 50 times what? 20, which is what? 1,000 milligram per day. But the question say per dose, right? Per dose. This is the key. 50 milligram per kilo per day. So for each day, patient is going to get what? 100 milligram, right? Per day. But here is a 2 doses per day. That means to get a total of 100, you have to divide it by 2. So the patient is going to get each dose, you get 500 milligram. The next dose, you get another 500 milligram, and the total of it become 1,000 milligram per kilo per day as the instruction gives. You see the trick? So be careful. Otherwise, you make a mistake. You always want to read the question they've given you carefully. So that's the first type of question. The next one is the same strategy. Start from the back and figure out what they're asking you. How many ml? That means volume. That's all. The nurse is going to give. An order is what? For morphine, which is what is prescribed. You're going to get 0.1 milligram, right? Every kilo, no matter what you weigh. If you weigh 20 kilos, yeah, and then we're going to multiply it times 0.1. For a patient who weighs, the patient weight is what? 75 kilos. The medication is supplied. Now they've given you how much is available. 10 milligram ml. That means every ml, there is 10 milligram in the medication. You have to give me ml that will be administered to the patient. That means for every kilo of the patient, you have to give them 0.1. The patient weighs 75 kilos. The medication came in with what? 10 milligram per ml. So convert this dose into ml. The key is because I need ml, the available, I have to flip it. Therefore, 10 milligram per ml is the same thing as what? ml over 10 milligram. Don't forget that. Therefore, what are you going to do? I'll put ml on top and I have 10 milligram. I just flip it so that my answer choice will be ml. Now, I have to bring the prescribed dose, right? Which is what? 0.1 milligram per kilo. The patient weigh what? 75 kilos. So I multiply here by 75 kilos. And you see kilo cancel kilo, ml cancel ml. This time, this is what? 75 over 10. And therefore, the answer choice is 0.75 ml, which is B, the number 3. This is the way you do it. And I know you figure it out because this is, you have to break the question, go for the keywords, and then rewrite all the things you need to do in a dimensional analysis way, and you'll be able to conquer this question. The next one. This one is a little bit harder, but you got to be careful. What is the total daily dose? That means the total amount that you're going to give. You always want to read this portion so that you know in milligram, that means I'm going to have milligram answer, but this is the total daily dose, right? A child weigh what? This is the child's weight, 18 kilos, right? It's prescribed, that's the prescribed dose. That means every kilo of the child will get what? 25 milligram per kilo per day in day. That means every kilo of the child will get 25 milligram of the amoxicillin per day to be given, but this is be given every 8 hours. That means TID. So within 24 hours, the patient is going to get 3 doses. What is the total daily dose? That means how much the kid is going to get throughout the day. Therefore, I need to what? Find the milligram. So we have what? 25 milligram, because mg is supposed to be on top, I keep it on top, per kilo, right? Kilogram. Per day means 1 over day. But the kid weighs what? The kids weigh 18 kilos. That's all. So this kilo cancel kilo, right? And you left what? 25 times 18, which is what? 450 milligram per day. This is where the trap is going to kill you. A patient is going to get 450 milligram what? Per day, right? They say, what is the total daily dose in milligram? Therefore, in each day, it's going to get 450 milligram per day. 450 milligram per day. It's not telling you how much the patient is getting per dose. Therefore, this is your answer. You're not going to change it. If you change it, you're going to get into trouble. If you multiply it by anything, you're going to get into trouble. The right answer is what? 450. You should not do anything to that. This is what the patient is going to get, but these will be given every 8 hours. So when you divide this by 3 times, you're going to get 150 every dose. Don't multiply it, right? Don't do anything. The question say, what is the total daily dose? So the total daily dose is going to get 250 milligrams per kilo per day. Therefore, if we weigh 18, you multiply by that 18 times that each day, this is what is going to get. But these doses to be given every 8 hours, 3 times a day. That means we have to, so that we can get the same total. The 450 has to be given 3 times a day to be total of 450. That means you divide that into 3. So you have 150, 150, 150, and the patient will get 450. But the question is asking you for total daily dose, which is what? That. That is the key for this particular question. The next one is what? The provider prescribed gentamicin, same strategy of what? 2.5 milligram every 8 hours. So the prescribed dose is what? 2.5 milligram per kilo every 8 hours. For a client who weighs 154 pounds. 154 pounds, you divide that by 2.2, and you're going to get what? 70 kilos. Now, the pharmacy supply gentamicin, the available dose is what? 40 milligram per ml. How many milliliter should the nurse administer per dose? So what is the ml that you should give for each dose? So I need ml to be on top. Same thing. This one, we have 40 milligram per ml. That means 1 ml is equal to 40 milligram. You flip it. Now, I got to get rid of, what is the prescription? 2.5 milligram, 2.5 milligram per kilo, right? That's been given every 8 hours. And I know the patient weighs 70 kilos. So kilos cancel kilos, milligram cancel milligram, and you have 2.5 times 70. That will give you 2.5 over, so you have 2.5 times 70 over 40, right? This will give you 4.375 ml. So this is it. In some questions, watch for rounding the answer choice in the 1 decimal place. So if they say round this in the 1 decimal place, most likely you get 4.4 ml. Or if they say nearest whole number, the answer choice is going to be 4 ml. This is the way you can approach this. But these questions, you have to look at them carefully, solve them, and pay attention to the keywords, and you'll be able to get it done. Thank you for watching. If you need more, check out Dr. NCLEX for this content. Take care and good luck.